Is this on? Can everyone hear? Well, great. Well, I'll get started. I know being the last, well, as they always say, being between here and cocktails is always hard, so I'm going to try to get through this fairly quickly for you guys and open it up. Let me first give you a background about Humana outside our cautionary statement. Two sides, just maybe many of you don't know, but Humana started out as a nursing home company in 1962, evolved to a hospital company, evolved to a managed care company, and then now is actually going back a little bit in time and is a company that has an insurance product, but really is also deeply involved in clinical services. And I'll explain why that in a second. And you can see both sides of our organization. The insurance side, which represents our primary revenue. We do about $54 billion. Of our largest segment is our Medicare Advantage segment. And I want to emphasize that because it's going to sort of lead through a lot of different parts of our organization as we get to the sustainable side. Medicare Advantage is a unique service that the federal government offers. It has a few attributes to it. It first is the individual chooses between Medicare and a Medicare Advantage plan. So they first make that decision. The attributes of Medicare Advantage is first it's guaranteed issuance. So what that means is that it's not an insurance product. Everyone can get the service. So if you are highly sick, we have to insure you, which we think is a great aspect of our business. The second part of it is that our revenue is then adjusted based on people's conditions. So if you're if you have you're mild diabetic, we get paid different than if you're a severe diabetic. It's called risk adjustment. So what that does, it's an upside-down insurance model that you actually get paid more for taking care of sicker people. And so we are incentivized actually to help sick people, as opposed to the normal insurances is to find and insure the healthy and not the sick people. And then the third thing which is important is that the individual decides, not the HR department. And so what you have is an individual decides, it is based on disease conditions, and everyone has the right to get the service. Now that represents of our $54 billion, about $47 billion of our revenue. And I'll go through what that means in a minute. Other part is we're one of the largest TRICARE providers of service, and then we do have a small group of commercial. But if you were to ask what does Humana do, we are a leader in Medicare Advantage. We have about 27% of the market share in Medicare Advantage. So let me give you I gave you a little bit of backdrop about Humana. Now let me talk a little bit about the industry. And you guys probably have saw a lot of this. And I just want to make a really important point of these slides is obviously demographics are growing. Seniors aging, about 10,000 a day, which many of you know. But also the demographics is moving to more chronic conditions. And you heard some of that today in some of the presentations. And it's both because of the aging population and because of our lifestyle. Why that is important is that chronic conditions are much different than an episodic condition. Episodic condition is like whenever you go break your arm or you have to have a surgery, you're in and out, and you might have some delay of cure or restoration, but it's not long. Chronic conditions is you live with them every day. So if you're a person with diabetes or COPD or some chronic condition, your lifestyle and healthcare are intersected. And that is much different than the way healthcare was in an episodic environment where it was more treatment-based. You went into the hospital, you got a surgery, you got out. You might have some rehab or some other kind of respiratory services, but it's very, very short term. In chronic, it is lifestyle. And so this evolution is an important part of the business model and the change in healthcare. And you've probably heard about it in a few different presentations today. This is an example as we think as an organization long term and as we think about how we can have an impact on people. This is called a disease progression curve. And we picked diabetes as an example of that because it's something people can resonate with. And if you see early on in the disease, you have a fairly low level of symptoms. But as you progress, some bad things can happen, all the way to amputation and blindness. And what I put on the bottom there is really when you think about our business model, and I was talking about this individual that stays with us for a long period of time, about 7 to 10 years they stay with us. It's the average retention of our members. And if you see on the bottom there, the average medical claims, if you move from low severity on a monthly basis, it's about $613. When you move to high severity, it's $4,000. Now, if you keep in mind that we actually get paid about $1,000 a month for Medicare and with our member. So the total is about $1,000. So we are highly motivated to ensure people do not progress along that disease curve. So you'll see when I talk about healthcare services and some of the services we provide, it is all wrapped around that concept of disease progression. Actually, the member that comes in the first year, we usually lose money on because we're investing in programs for them. Now, I'll get in a second about this, but we have about 9,000 nurses that we have in our home health company. And what they do is they go to people's home. We don't bill for it. It's not a service that we bill for. It's part of joining Humana. They'll go to the home and check to make sure they have a ramp, make sure that if they just got discharged from the hospital, they have the right food, because we find readmissions as a result of lack of nutrition. Are they taking their drugs? Do they have a shower rail? So we are constantly trying to figure out how do we help them in their day-to-day lifestyle. And it's all around this disease progression. And every chronic condition has this particular graph. So my last slide on the industry is just how the industry is evolving. Now I'm talking about insurance. Insurance was originally created from an employer group point of view, where a few things were important: aggregate size to negotiate with providers to get a lower rate, and to aggregate size to have broadness of choice for national employers. So if you were IBM in here, you wanted to be able to offer a consistent product through every geographic location, so you needed someone to do that for you. And that's really where the insurance market started from, and it just has evolved since then. What you're seeing happening because of the merging of chronic conditions and the realization that the ability to help somebody's health is in the best interest of society, and it's actually a great business model. You're seeing the evolution move from a transactional kind of relationship with providers and customers to a relationship that's much more around advancing health. And so you heard a few comments today about value-based reimbursement and moving this quality and cost to more of a payment as opposed to volume, treatment-based. The more I do, the more I get paid. And this evolution is really occurring. But the other part of that evolution is that we begin to start removing the friction points in the industry where people it's really hard to navigate through the healthcare system. And so where we see us moving, and as we think long-term, we're moving from the second top box to the top box, where the integration is just not about financial integration, but it's about process and integration of data and the ability to flow through the system and take those friction points out of the system to make it easy. And I'll get to our goal in a minute as we set, well, I'll tell you now. We've set an enterprise goal in our company that goes something like this, that we improve the community's health by 20% by 2020 through making it easier for people to achieve their best health. And that goal really brings our business model together, where we're trying to improve the community's health, because health is a community base. We've set a goal, and I'll get into that in a second of how we measure that goal, but we make it easier for people to achieve their best health. And we feel that if we can help each individual out, personalized and focused on their needs, the community will also be successful. I'll get into that in a minute. So our business model is not an insurance business model. It's a healthcare business model, but it's really wrapped around health, because that disease progression is the core of what we're trying to get accomplished. Now let me talk a little bit about the how. Just a little basics on this. In fact, in Washington today, this was a topic of conversation, and I know it was a conversation just a few hours ago. It's just not about coverage. It's about cost. If you think about our revenue, of the $54 billion, 85% of that is of medical cost. So anything we do is really an expression of the cost of healthcare. In fact, we're regulated that any time that our costs go below 85%, we actually have to write a check back to the federal government and to our members. So we're actually regulated. So if we can continue to drive down healthcare costs, we can make it more affordable. If we can make it more affordable and have a competitive advantage, we grow our membership. We don't have a demand problem. We have more of a cost problem. There is a lot of demand out there with the aging population and chronic conditions. We have a cost problem. And so everything we do is really wrapped around three things. It's wrapped around clinical programs, and I'll get into those in a minute, around experience, simplifying the engagement with somebody, and then the third is driving more efficiency within our system as a whole. How can we be more efficient and be able to provide better services back to our members? We have 5 points of influence in our company that we focus on and say, these are really important parts of healthcare that we want to insert ourselves on and partner with. One is around prevention and wellness. Now this, many people will say, is around running a marathon. That's not the case. It's about engaging with a diabetic for an eye exam. That's an example about a prevention and wellness, where you're really getting to that progression curve and getting early in the progression curve to stop blindness. And the more we can do that, the more we're going to help people. Second part is primary care. We feel that primary care is the core of healthcare and makes a lot of decisions that have downstream, whether it's the referral to a specialist, to sending to the hospital, preventing ER visits. They are critical to the success of population health or value-based reimbursement. The third is pharmacy. We have about a $20 billion pharmacy business in our organization, and it is all around how do we get people to follow their prescriptions. The most costly decision in healthcare is when people don't take their prescriptions. Something always bad happens. So the more we can help people adhere to their prescriptions, the stronger we are, the stronger society is, and the better the member is. Other is home health. You heard a little bit about that before, is moving people out of the institution to home. We have about 1 million members in our home-based service. It is all wrapped around people being comfortable where they're at, providing their nurse care, even physician care at home, providing remote monitoring, and other devices where you know that you are going to intercept when needed. Then lastly is behavioral health. We have a belief that if your mental state isn't healthy, your physical health will not be healthy. So if you look at all the places where we spend our money and effort and innovation and all the things we do, it is in these 5 areas. If you look at the companies we own, how we partner, it all wraps around how do we bring these together, not only from an individual point of view, but from a connectivity point of view. This just gives you a revenue. Our membership, and as you can see, this is just our Medicare membership, but demand is not a problem. This is our revenue overall, and this is our earnings per share. But I really want to turn, I'll talk about capital deployment in a minute. We have some stock buyback, but the most important capital deployment is in our capital investment in our clinical capabilities. You will not probably see us buy an insurance company. You'll continue to see us invest in home. And we're doing a lot of investment in home because we feel that's where, A, the patients want to be, and it's most cost effective. B, a lot in the primary care area, both in investing in clinics we own, but also partnering, because what we believe in is that partnering with providers is a very important part of what we do and an important part of the healthcare system. We don't believe that one company is going to solve the healthcare problem. It is going to be a partnership and integration across the healthcare system. Behavioral health, continuing to build that. A lot of things in behavioral health are not only about the clinical side, but access. In San Antonio, we back up, we have divided our membership into personas, 15 different personas, and those personas are how people engage in their health. So we have a control seeker, we have an overwhelmed individual, and what we found in San Antonio and certain personas that, especially in the Hispanic culture, that behavioral health was a no-no, and access was really hard. So what we did is through our innovation, has brought virtual behavioral health to San Antonio. And we have seen some great results from that. It's the ability to engage in somebody in their home where they don't have to be embarrassed if the culture doesn't support it. And in addition, it's easy, both for the provider and for the individual. And then lastly, continuing to build out our pharmacy capability to be at the front line and be local, so that when someone walks out or is in the home, we can provide the dispensing at that time. So let me turn to our bold goal. I've mentioned this is what really drove the organization and is driving the organization, and we measure it by healthy days. And healthy days is a CDC measurement. They've been doing this for 25 years. We're actually the first company to embrace it. Because when we set this goal, I kept on asking the question, how are we going to measure it? Tell me a time and tell me the measurement we're going to measure. And we came up, through a lot of research, we came back and said healthy days is the best barometer. And it's very simple. It's 4 questions. It's questions about your mental health and your physical health. And our theory is that we could give you all the statistics about your health, about your BMI, about your heart rate and all the other things, but if you don't feel healthy, mentally and physically, then we're not doing our job. This gets back to that simplification, gets back to that engagement, gets back to also just how you're feeling. And so what we did is we set a goal in many different populations, our senior population as being the most important. What you see is up here, a summation of the unhealthy days for our members and the population as a whole. We've seen about a 10% improvement over the last 2 years in our healthy days, or unhealthy days in this particular case. And the idea is we are going to constantly measure how we're going to improve the health. But most importantly, we're also going to measure how are we engaging with those individuals for them not only to be physically healthy, but also mentally healthy. We've also done that with our associates, and I hold my HR team responsible for improving the health of our associates. And what you see here is our decline in unhealthy days for our members. For our associates. And what we've found is, it's ironic, is that the younger population, 25 to 40, has more unhealthy mental days than physical days. And if you think about it, they got stress in their life, they got dual working, maybe not as much income as they would like, children running around, so their life is pretty chaotic. And so as we think about programs for a certain part of the associates, we think about how do we reduce the stress. As you age, it actually inverses. Your physical health becomes a higher priority than your mental health. And what we've seen is the ability to alter this based on the segmentation in our population has been really helpful, not only from a point of view of having an engaged population, but you can see up here our engagement scores. Now, I want to put those engagement scores in context because I think many of you know that we were in a prolonged merger with Aetna. Our engagement scores stayed at 90% during a 21-month time during that merger. And I always said is that we have deposited dollars or cookies in the cookie jar in being able to worry about our associates' well-being, and that has paid off. And today we see this constantly coming back. There's 2 things that we always hear back from our associates. First, the bold goal and our values, makes them proud, and makes them want to come to work. And that we walk the talk by worrying about their well-being and measuring their well-being. We have this thing called the Well-Being Index. It's got 4 points to it. 1 point is the social side, 1 point is the financial side, 1 point is their health, and 1 point is their work. And we measure that. And each one of our leaders are held responsible for that. So we know when someone takes out a 401k loan that their financial side isn't where it should be. And then we provide them, obviously, coaching and other matters like that to help them with that. We know if they aren't active in some of the community events we have, their social side. But we're constantly measuring this, and we have found it to be a great engagement within our organization and a great improvement in productivity, but also a great way to hold talent. And then lastly, I'll just end it, and then I can open it up for questions, is we've won many awards. We're not an award-driven company. This has just been an expression of our commitment both to sustainability, both in the environment, but also sustainability in our health. So I'll conclude by saying that our long-term view is that we continuously focus on improving our members' health. And if we can do that, it's a great business model. Now, we're going to do it not through our insurance is the way the revenue is generated, but we do it through our clinical capabilities and partnering with providers out there to advance that. And it's really an evolution, I think, of the healthcare system. And I am very optimistic in the future that the healthcare system is going to move more from a treatment point of view to a health point of view. The demographics require it, but I think the system requires it too. So with that, I'm going to close and open it up for questions. And if you don't have any questions, the drinks will be out there.
Not quite. I have 2 more minutes before I leave. So, thank you for that. That was wonderful. Questions? Must have a question. There we go.
Yep.
Hold on.
Dave Kirkpatrick, SGF Ventures, often M&A and culture. You've talked a lot about your values and culture, which was inspiring. How did that play out over the last couple of years with this merger situation?
As I said, it has really been the grounding of the organization. Our turnover rate has gone up by about 1% or 2% during the period of time. But it has been just the root that has kept the organization going. And to me, we've had a few things that we've been constantly reminding our organization is, one, keep the customer focus. All this other stuff is just static in the air. Let's keep the customers in the focus. The second is no regret moves. Don't compromise the long term for the short term. And we constantly ask, what is that no regret move? And we've made a few acquisitions. We made a number of innovational investments. And it's always been focused on what is going to make the company, if the deal closes, to be a strong company inside Aetna. And if it doesn't close, what's going to be the move that's going to make the company strong independently? And today, we had a wonderful year in 2016. We have some great things going on in 2017, innovation-wise, and we have a very, very excited company, and a company that people say, I just can't believe that this company has been under that environment for 21 months. It's been great, and great. I mean, hats off to our 50,000 associates. I mean, it's been wonderful.
And Daryl, I think you had a question?
Yeah.
Mike's coming.
Okay. I don't know. Can you share any of the insights or what you heard there with the group?
I do think there is a desire to get this fixed. This fixed is ACA. And there is what's referred to as a spiral going on as a result of that. And so there's a high desire to get that fixed. I think the details of that are still being worked out, but I would say that there's a high desire to get that fixed, and I think they will be coming out in days and weeks with details.
In your sense, that's fixable?
It is fixable, let me say, but it's going to have to really require some structural changes. And just in that, what really happened was an accumulation of events that happened that caused us to get where we're at. Just to put it in context, Humana has lost about $1.5 billion on the exchanges. And today, about 10% of our members represent about 80% of our cost within the exchanges, not within Medicare Advantage. So it's a highly, it's a population that is requiring to use the healthcare system a lot. And there's accumulation of things that happen. One was when the President Obama decided to keep your own plan. That kept all the healthy out of the population. That was the first one. The second was the special election period, and that was where these were periods where people could come into the program based on job change or some other life event. But there's 35 of them. Mm-hmm. The third was grace period, that you could not pay. We were required to have a 90-day grace period. So if you didn't pay, you could still use the healthcare system for 90 days. Then what ended up happening is people wouldn't pay on October 1st. They would use the system, and then on January 1st, they would just re-enroll. Mm-hmm. Or they would just not. They would use all the healthcare and then not pay. So we had those issues. Those, along with some funding. The government didn't fund some programs that were originally identified, all created where we're at today. And so what's happened is the healthy have stayed out. It's gotten more and more expensive. And so only the people that need the health insurance are going to buy it. So you have the spiral going on. And to stop that spiral, you got to structurally change it. So.
Thank you.
Thank you.
Bruce.
Guys, thank you very much.